Hi, I'm Dr. J. Tim Rainey. I'm here with my friend Dr. Jim Erpenbach from Tennessee. And Jim and I are sitting here discussing some of the merits of minimally invasive preventative dentistry.
Yes.
What kind of questions do you have for me, Jim?
Tim, if you would, you are one of the innovators and discoverers of air abrasion and minimally invasive dentistry. You coined that term. If you could please describe that, tell us what air abrasion is and what minimally invasive dentistry is and how that applies to patient care.
Right. Minimally invasive dentistry is exactly what it says it is. What we want to do is do the least amount of damage to the healthy tooth structure while we're targeting the unhealthy tooth structure. And if we can do that, do it effectively, it turns into preventative dentistry. It solves the problems that come along with standard dentistry, the drill, fill, and bill, which does nothing but set the patient up for a cycle of failure. What I did was I didn't invent the air abrasion. I did invent micro air abrasion, taking it down to where we use very small tips, use miniature air abrasion tips. All we're doing is sandblasting. That's it. It takes out the unsound tooth structure selectively. It would take you forever to cut normal, healthy tooth structure.
Very good. And what's the benefit with minimally invasive? Why is that important for patients to understand that? And how does that set that apart from what traditional dentists do?
Well, what we do is we take people like Jim, and then we bring them into our teaching group, the Texas Institute, and then we put them through a series of courses. We require that they do training. We require that they act as mentors in other courses, which Jim has done. He finished up one of his mentorships today, which makes him an instructor trainer in minimally invasive preventative dentistry. So what we want people out there who can teach this, out there who can understand it, and can help promote the dentistry. What we're doing is so effective that we have put a professional lifetime permanent warranty on the posterior teeth that have erupted in my practice. Now this is 31 years, and very seldom do we have to go back and do anything to the teeth that we have treated over all of these years. And you're talking 3 decades. Now then, considering that the average life of a traditional drill, fill, and bleed, drill, fill, and bill,
Yes.
GV black bomb, those are around 14 years. And then you redo it again in a little over 7 years. And then you continue to redo it over the period of the patient's lifetime. And the projected cost, according to Pew Institute, is the projected cost over a period of a natural lifetime, average natural lifetime for a person, is going to be somewhere in the neighborhood of $6,000 per tooth that has been drilled on. So when a dentist makes that decision to drill on a tooth, then without telling the patient that there are other alternatives, then you can see where the devastation and the damage occurs.
So the advantage is less is best. The least invasive we can do, the better off we are. The more tooth structure we can save, the better off we are. And with this technique and protocol, we're early stages, we prevent problems. You put a revolutionary type lifetime warranty on this restoration, which is really a great thing. You don't get that every day. So less is best for the patients. If you have an interest in this, check out the rest of our website for information on air abrasion, and give us a call for more information, set up a consultation. I think you'll be glad you did. Tim, thank you. I appreciate it.
Thank you, Jim.
A pleasure.
Thanks for being here.
Our pleasure.
Appreciate it.